We are live. This is pretty cool. This is our first Natura live event. We're going to get into more intros in a minute, but if you are joining us, thank you so much. Thank you for your patience. This is literally the first time we've ever done this.
Our maiden voyage.
Exactly. So the way it works, and we'll get into this a little bit more, but feel free to comment if you're on Facebook specifically. Comment in the live feed on Facebook, and we will see those comments. If you have questions, then we can go from there, and we'll bring them up and talk about them.
Great.
So.
All right. Shall I launch into things, or do you want to? Is there any more technical advice we need to offer, Dr. Smith?
I don't think so.
Okay. All righty. Well, again, welcome. And just to kind of orient us to space and time, this is March 21st of 2025 when, if you are not watching us live. And I'm just going to introduce myself. My name is Dr. Christine White. I am a naturopathic physician. I'm one of the doctors, the founding members of the Natura Health and Wellness Clinic. We're here today with Dr. Michael Smith, who is another one of the doctors at our office, and Hollie Greenwood, who has a Master's of Science in Nutrition, and she's an account manager for a company called Bioclinic Naturals, who happens to be making the particular product that we're going to be spending most of our time talking about today in this conversation about blood sugar regulation and the various herbs that we can use to treat that, but more specifically, this class of herbs called berberines. And if Michael wants to just throw up real quickly, we have a picture. I always like to, when I'm talking about herbal medicine, is to relate this back to what we're actually talking about. We are actually talking about plants. We're not just talking about pills in a bottle. We are talking about a group of plants that have a yellow substance on their roots, which you can sort of see in that dried root picture. And these are herbs like Oregon grape, which is an indigenous herb to the Northwest and the Rocky Mountain West. There's also golden seal or hydrastis, which is a little bit harder to cultivate herb. And then there is barberry. And the product that we're talking about today is berberine. Help me, Hollie, the lipomycelial.
It's extracted from Berberis vulgaris, which is a European barberry.
The European barberry. So I think, so what we're talking about today is we're talking about blood sugar. We're talking about this class of plants. And for us as naturopathic doctors, this is just one of the multiple tools that we have. There are a host of herbs that work to help modulate blood sugar. And they work by different mechanisms of action. And then also one of the beauties of herbal medicine is that these plants don't just do one thing. We are going to talk about we're going to talk about berberines today as their ability to lower both pre and post prandial or fasting blood sugar, as well as after meal blood sugar. But this class of plants is also a powerful antimicrobial. Meaning they're antibacterial. They have antiviral properties. The berberine class actually has some anti-cancer properties. We were just actually having an interesting conversation before we went live about this class of plant and its ability to be useful in a traumatic brain injury, because this plant can actually cross the blood-brain barrier. So many uses to this plant. And when we as naturopathic doctors go on to prescribe various things to patients, we really try to take their whole picture into account. And if somebody's got, 3 different things going on, we like to try to pick a single herb or a few herbs that treat all of those things, not just sort of the primary diagnosis at the top. So with that, I just sort of want to say we're also not here to talk about magic cures, but we are pretty excited about this new berberine formula. And Hollie's going to dive into a little bit more detail with that later. And I think first what Michael's going to do is talk to us a little bit more about blood sugar regulation and blood sugar dysregulation, and what that sort of means. And then we'll kind of go into the specifics about this specific formulation, and then we'll kind of come back around to talking about how you might weave this into a plan for yourself. So yeah, go for it, Michael.
Yeah, so it's kind of like, I like to use the analogy when I'm working with patients of our bodies are like a car, a vehicle. And in order to operate, we need fuel. there's lots of ways we get that fuel, primarily from our food that we eat. And when we eat food, and I'm going to focus narrowly specifically on glucose, our bodies need to do something with it. We can either burn it, use it right away. We can store it in more of the short-term sugar storage called glycogen, or we can store it in the long-term storage, otherwise known as fat. And our body is always regulating our blood sugar because we need enough to do the job, but we also don't want too much sugar in our bodies. It can have downstream effects on our nervous system, on our kidneys, on our skin, on so many different body systems. And so our body has different mechanisms for regulating our blood sugar. One of the main ones being insulin, a hormone that comes from our pancreas, and that helps kind of open the door, so to speak, for sugars to go in, for sugar molecules, the glucose molecule, to go inside our cells. I was pondering on insulin recently, and I really like the analogy from Monsters Incorporated, the movie, the Disney Pixar movie. And you might, if you've seen it, you'll remember the scare floor where these monsters, they get their energy from scaring kids. And so there's one monster, the Mike is the little green guy. He goes in and he swipes a card, and then a door comes in on which Sully, the big hairy fully monster, comes in and then scares the kid through their closet, comes out, and then they capture the scare energy, and that's what they use for their power. And I think how insulin is kind of that like Mike Wazowski kind of thing that swipes the card and brings in the door being the glucose transporter enzyme from inside the cell to the surface of the cell membrane, that the sugar can then go in and create this energy. It's not a perfect analogy, but I think it works really well. And what's really cool is that berberine helps with so many different aspects of that blood sugar management. It helps to increase the amount that which the glucose transporter comes in. It helps to increase the insulin sensitivity. We often think about insulin in terms of diabetes. When our body either A, doesn't make enough insulin, that's kind of the type 1 diabetes, or 2, when we just don't, when we become resistant to it, it doesn't work as well. And that's, so the berberine, this alkaloid compound that's found in these roots of many different plants, helps to make our bodies and our cells more susceptible to sugar. It helps us process things, helps us be able to adapt and weave in, get the sugar that we need without going overboard. So it really is great for a lot of management things as we think about how to regulate blood sugar so it doesn't get too high, doesn't get too low, but keeps us in that nice, happy medium range.
And I think a really important piece that you just said there, Michael, that I think is important for people to get a grasp on over time, or as you think about this, is that it's not just about having too much glucose in your system. It's also about our bodies who those monster doors become resistant to opening. Mm-hmm. And that's a big piece. And that's where people start to get frustrated sometimes as they're on their own journey to try to lower their glucose levels overall, is that you can make some of these significant dietary changes and reduce your carbohydrate intake, which is ultimately glucose. So we're talking about everything from, honey to a chocolate bar to fruit to, a piece of bread. I mean, carbohydrate is what ultimately most rapidly gets turned into glucose. So the beauty, again, of what we're going to talk about, and that Hollie will get into a little bit more here shortly, is that this class of plants makes those receptors more receptive to the insulin and more receptive to sort of clearing the glucose from the bloodstream. And so when you need that extra bit of help, that it isn't just about exactly what's going in your mouth, but getting your body to behave differently, So that's where this all comes. That's where this comes in and is so useful.
Yeah. Brilliant.
So, do you want to talk maybe a little bit, Michael, if you would, just talk to a little bit about the kind of the idea of fasting blood sugars versus postprandial or after meal blood sugars? And I think that might lead well then into, we'll have Hollie jump in a little bit then and start to talk about this particular berberine formula.
Yeah. So when we eat, we look at we can follow the journey of food. The food goes in our mouth, we chew it, and that saliva helps break things up. It's really important to chew. Then it goes into our stomach, then into our small intestine. That's where it's really starts getting absorbed into our bloodstream. And those sugar molecules accumulate in our bloodstream. We need to have they typically go up and then they peak. And then as the digestion process keeps moving along, food keeps going down our intestines, that blood sugar will then decrease as well. And we want to really manage that so that we don't have a ton of spikes, a ton of peaks, but it kind of it stays balanced in that way. And for somebody that has diabetes or maybe, I guess I would say elevated blood sugar, that's monitoring their blood sugar, whether they're pricking it, whether they have a continuous glucose monitor, their goal is to keep their blood sugar within a certain range. And we often measure that in the form of blood testing. When somebody comes in to our clinic or somewhere else to get a blood draw for blood sugar, we do it in the morning because that's when the blood sugar is usually the lowest. We don't want to measure it right after a meal because then that would kind of give a false reading of what's really going on in our blood sugar. But we can track it, and we want to make sure that it is kept in that range. And with one of my patients who I've been working on with blood sugar, it's she's been trying her diet thing. She's been working on improving her lifestyle to better eat, to eat better, to assimilate the sugar that she's eating. But she needed some extra help. So that it was right around that time that I was helping her that we learned about this product that Hollie's going to talk about. And it's been really interesting because my patient had a continuous glucose monitor and was able to track live time how things were going, and it's worked really well for this patient to kind of lower that blood sugar to kind of keep things better in control. Certainly there's things that come and go with diet, with life situations, with stress, with getting a cold that can affect blood sugar, things like that. But overall, it's been a really positive experience. And that's, I think, one of the reasons. I think Dr. White probably has similar experiences with her patients. But that's why we're really excited about just berberine generally, but this particular product. And
and I would just, go ahead. Sorry.
And and just the fact that it's not a medication. It doesn't have all those side effects and other things.
Right. It doesn't have all those unwanted effects because this is a plant material, not a super synthesized pharmaceutical. The last piece I'll say here is, I've been at this medicine for more than 20 years at this point, and I have been using berberines the whole time, whether I'm treating GI infections or systemic infections or trying to help people with their blood sugar. And at this point, there are over 5,000 citations about berberines in the medical literature about what it can do for the human body. So this is certainly not some sort of brand new or unknown substance. And so again, I've been using this for years, and I've never felt like I could find sort of the perfect patient or the perfect scenario where the berberines were actually impacting someone's blood glucose like we sort of knew from the research was possible. And so that's where Bioclinic Naturals, in the work that they have done, have come up with a way to basically re-engineer berberine so that it's more effective. And the last thing I'll say before I hand this over to Hollie is I'd like to talk to patients about this as well. There's this belief in oftentimes about natural medicine, about naturopathic medicine, that we should only be using sort of plants in their whole form, or things exactly the way they appear in nature, or nutrients only at food-based doses. And I think the beauty of this sort of medicine is that when we understand the mechanism of action for something, we can use it in higher concentration doses, almost as if it was a drug, except that it's not a synthetic substance. It's a natural thing. And sometimes people are really resistant. It's like, no, it's been like altered in the lab. I don't want to use it. And well, I think on some level that is a decent caution to have about anything we put in our body. I think that, again, the beauty of this medicine is that we are at this point where we can take, 2,000-year-old understanding of what certain plants can do, and compare it to 100-year-old eclectic herbal medicine about what we know the plant can do, to now we've got this really innovative way of getting berberine into the bloodstream. So I'm going to be quiet and I'm going to hand this over to Hollie.
Oh, I'm writing notes because you brought up a really good point that I want to address.
Perfect.
So thank you both for setting the stage on berberines and blood sugar regulation. So as we mentioned, Bioclinic Naturals, who I represent, came out with a brand new product that is extracted from European barberry, and we actually trademarked it. It's a brand new technology. It's unique to us. And so this technology, what it does is it creates a liquid micelle matrix, and that disperses the berberine into tiny little micro droplets. And this results in a much higher absorption than powdered forms. So as Dr. White was just alluding to, she'd been using berberine for years and hadn't really seen the dramatic effect that she was hoping for, given the sheer amount of literature that's on it. And what we have found is that the standard powdered berberine, of which she's referring to, only 5% gets absorbed, which could be the reason that we're not seeing dramatic results that we were hoping for. Nothing against, the plant. It's just, trying to engineer a way to make it more absorbable to the human body. So what's really cool is that this Berberine LipoMicel has shown a 10% increase in blood concentrations over the standard berberine in just an hour. And Michael or Dr. Smith, if you wouldn't mind just putting that slide up real quick. So this is you can find this study on PubMed. We can certainly give you the reference for it if you'd like. This basically just compares the Berberine LipoMicel to regular powdered berberine, and just shows how quickly it gets absorbed over the standard one in just an hour. And this is just with one capsule. That's all the study showed. So thank you for that, Dr. Smith. And then there's another study that has shown it to have a 12% reduction in blood sugar levels within just 2 days. And again, this is just one capsule per day dose. So we're not talking, having to stick a lot of pills, into the body every day. It's literally one. So I think that's a really good example as well. And so the Berberine LipoMicel is, in addition to helping with blood sugar regulation and increasing insulin sensitivity, it also is really good at penetrating biofilms and the cell walls of both gram-negative and gram-positive bacteria. And it also has really good effects on yeast as well. So I think that's really a cool, just sort of aside.
Yep.
Dr. White and all the other things that it's good for, but.
Well, and let me just actually jump in there really quick, Hollie, because I think you just made a super, super important point, and I don't know how much people understand this piece. This idea of biofilms is, this idea about biofilms has been around. We've understood this for a long time, but it's really gained traction in medicine in the last, decade or so. And, biofilms refers to this, I'll oversimplify this layer that fungus and bacteria can create over themselves that make them impenetrable to cytotoxic agents, to things that could kill those microbes, as well as somewhat invisible to the immune system. And where I think this is such a beautiful blend with berberine and the gut and blood sugar is that while the berberines are having their action on lowering blood sugar, they're also having an action at the exact same time of working on sort of dysbiosis, like microbial imbalance in places like the small intestine, which is further impairing sort of our body's ability to to sort of modulate and regulate optimally. And so this just becomes another beauty of why I love plant medicine so much, is that we've got something that we know acts at the mitochondrial level to improve the way the body deals with glucose. At the same time, it's antimicrobial, it's supportive of the liver, and it's going to penetrate these biofilms. Because I guess the point I'm trying to make here is that when people have chronic infections, there is a biofilm. Biofilms are normal and they're good. And then we can end up with too much. And when a biofilm is present with an overgrowth or an infection, you're not going to get over that if we don't get through a biofilm. And so this just becomes one more reason why this formulation I'm so excited to use this with more people.
Yeah, well, thank you for that. And I think to your point, yeah, it is important to be able to break down, both that gram-negative and gram-positive bacteria. But I think one other thing is pretty cool about this product, if I do say so myself, is that a lot of naturopathic doctors are often pairing it with NAC and acetylcysteine to break down those biofilms. And what's cool about our product is that because it's so effective at breaking down the biofilms by itself, that NAC isn't needed. So it just makes the healing protocol a little bit more streamlined. So not many products are being needed to do the same thing, which I think also is very cool. So I like that idea as well. So I think the other thing, if we have time, do we have time? I'd like to
go for it. Go for it.
So here is a handout that I created because I think a lot of people who have been using supplements for a while are privy to this new sort of technology of liposomes. And so people have asked when we developed this product, like, well, what is the difference between liposomes and micelles? Because it sort of sounds similar and maybe they do similar things or maybe they don't. So what I'd like to do is just go through some of the highlights of the differences so that you understand that there is a big difference. So even though that handout is kind of small, you can still see, and again, we can, as I just highlighted there, we can send you this handout if you'd like to look at it in more depth. But essentially, the liposomes have a double membrane or a bilayer, whereas the micelles create a single membrane. So there's actually just less processing involved. Another big difference is that liposome technology is really good for hydrophilic, water-stable, or soluble, I should say, constituents, whereas the micelle technology is best for hydrophobic or fat-soluble constituents like berberine. And that's why this is such a great pairing, is because of that, what I just said. So the liposomes have also a lot shorter half-life than micelles do, due to their larger molecular size. And then also liposomes are more expensive to manufacture. And so the micelles are cheaper, so just better pricing for you. The other thing I'd like to point out is that berberine is a very large compound, and it can be prone to degradation by enzymes and by stomach acid. And the micelles actually protect the berberine from that degradation. So that could be another way that it works so well. The other thing to point out is that our LipoMicel technology uses only natural food grade ingredients, unlike other micelles that use solvents or synthetic detergents, which for some people it can cause IBS. So it's good to be able to avoid that. And the other thing I'd like to point out is, and this is more just on the differences between standard berberine and micelle, our LipoMicel berberine, is that powdered berberine can cause a lot of digestive side effects for people sometimes, like diarrhea, cramping, gas, things like that. And I think the main reason for that, and you guys can certainly pipe in here, is the fact that it just isn't absorbed very quickly. So our particular LipoMicel won't typically have those side effects unless, big caveat here with an asterisk, unless somebody is taking more than the suggested dose per day. So I like to recommend, just from the trainings that we have done and the feedback we've gotten from the field, that you really only need 1 capsule per day to have it be effective. On the bottle, it does say 1 to 2 capsules per day. So I think everybody is individual, and you just sort of have to, work with your doctor to decide what's best for you.
I think it's great. Did I interrupt you?
No, I think that's good. I think that's the only thing I just wanted to close with is just, keep in mind proper dosing. Only 1 cap per day with a meal is really helpful. And that's really all that's needed to keep those blood sugars steady for the entire day versus the standard berberine. Typically, the dosing would be 3 capsules per day for like 4 to 6 weeks before they notice a difference. So,
yeah. And again, I think it's the speed at which we're seeing people respond to this is such a great thing. And I also want to speak a little bit too. I think it's part of why I wanted to do this and why I wanted to invite Hollie and have her speak a little bit really more to the biochemistry and the physiology of what we're talking about is that I see a number of things happen. First off, oftentimes in the realm of natural medicine, it's sort of presumed that there isn't really any science behind some of the things that we do. And I think clearly we're making an example here with berberine. I mean, if you've got over 5,000 articles in PubMed about a particular plant, obviously it's gotten some notice. And then, we're sort of taking an understanding of how the body absorbs things and trying to improve upon that. And part of the role for us as naturopathic doctors is honoring the Latin root word for doctor, which is docere, which means teacher. And that's why oftentimes, if you were to come see Dr. Smith or me, or really most any naturopathic doctor, we're going to spend a bunch of time educating you on things that maybe, after this 15 minutes from now, you can't really tell someone else exactly what Hollie just said about berberine, but you understood it at the time that we talked about it. And that's always really important for us is that when we're recommending something, that at the time in which we're having the conversation, you understand what we're talking about. And then we can certainly repeat over time and kind of help cement it. But it's the difference is that when, example, people with blood sugar dysregulation, you might be taking metformin, you might be using an Ozempic, you might be using, if you're using an insulin, I think people tend to understand that mechanism of action a little bit more. But part of what is so important to me about blood sugar and blood sugar dysregulation and this term diabetes is that there's so much judgment that often goes with not being able to control your blood sugar properly. There's a lot of shame that people internalize. And this kind of information to me is about trying to take all of that out of that and try to understand that there's various ways to do this. And this is one tool. And clearly we have to pay attention to diet and we have to pay attention to lifestyle and we have to sort of pay attention to all the other parts of the body. As a naturopathic doctor, we never just treat one thing ever. It's like you can come to us for one little thing and you leave with a treatment plan that's addressing 4 other things. And it's because we had to get to those 4 things to get to the one. Mm-hmm. So the more information we can give you and the more we can help you understand, that's really sort of our goal. So, go ahead, throw something in here.
Yeah, I'll just chime in. Like, I think you kind of hit it. Like, when we're treating somebody with blood sugar dysregulation, diabetes, in this example, berberine will likely be on the list of things that we try. But at the same time, there's not really a protocol for anything. Like we might have it that right. We use often, but really, and I know the same is true with you. Having seen you practice, it's every treatment plan is different, and it's going to usually include some diet, life, and lifestyle counseling, teaching, and really that teaching about what is going on and how we can do that. Yep. I think there's to kind of remove that shame. You talked about recognizing that for somebody with weight gain or other challenges, there's a lot of things that are often beyond our conscious control going on behind the scenes that are affecting our health, whether it's our thyroid, whether it's our blood sugar, whether it's whatever, all these different body systems, hormones that are at play that we really can't consciously control. So that's what I love my role as a doctor. And I think you would say the same thing, Dr. White, about being able to teach people about what's going on, but B, empowering them to do something, that taking that unconscious and say, okay, here are the things that we can do to modulate those things that we can't fully see through, but yet we can peek at through labs or whatever. Here's berberine. Here is medication. Here, metformin might be needed at some point in time. We're not opposed to that. We prescribe that when needed. But really, that whole person approach that makes the healing complete.
Yes. And, you know, to get to Deanna's question here, Deanna's got a question here about potential for anti-inflammatory. Absolutely. Berberines are in a class of herbs that are also anti-inflammatory. That's why it's such a really important herb. And I've probably used berberine more often in any form in my practice than any other single herb in the last 20 plus years. But yeah, it is anti-inflammatory, and that's an important piece.
Mm-hmm. I'd like to point out something too that you both just sort of highlighted, which is that, you know, the cool thing about using something like berberine in this particular way that we've designed it is that it doesn't need to be used forever. Like literally the purpose of it is to help with insulin sensitivity. Once that has been accomplished, then, you know, then the big work has been done, and hopefully and potentially working on diet and lifestyle changes and stress modification, things like that will have more of a bearing on your overall health. And so I think it's really important for people to know that this isn't something that has to be, you know, used every single day of your life for the rest of your life. That once you get it, and that's what's so cool about herbs is that a lot of times, not all, well, all the time, I would imagine, that they are getting to the root cause. You know, and so for those people that are super frustrated because they're like, God, you know, I don't know what else I can do to manage my diet or make my diet any better than it possibly is. You know, that is possibly the reason is that we're, you know, it's just not helping that insulin sensitivity piece, which is where the berberine comes in. So I think it just paves the way for all these other modifications that people are doing to do it better. And so it's not as frustrating to people. So that's what I love about naturopathic medicine is that I'm just such a huge proponent because it is getting to the root cause of the issues. And that is so different than what the allopathic medical model does. So I'm always a fan.
So with that, I think, you know, we probably should wrap this up. I think what I would say is that if this topic has piqued your interest, if you find yourself in this category, I would encourage you to give Natura a call. We do 15-minute free consults with people. So if you think you're interested in this topic for yourself or this kind of medicine in general, call. And what I would suggest is call and ask for a 15-minute free consult with Dr. Smith. I too see new patients, but my schedule is scheduled a little bit differently. And so I think if you reach out, Dr. Smith can do a 15-minute free consult with you. And then if you decide to establish care with us, and you mentioned this presentation, we will give you 15% off this berberine complex, this LipoMicel Matrix, for the first 90 days that you are working with us. And so that sort of means a couple things. One, I would encourage you, if you want to take on this piece of your health, then take some positive action and get yourself some help from someone like us who can help you do that. And secondly, we also can't sell products to people who are not our patients. So Natura specifically, we need you to be a patient of the practice before we can provide you with this. But we would love to hear from you, and we hope that this information was useful and helpful. And any other words from my compatriots, or shall we call it good?
No, this has been great. I love the conversation. We could, this is like a 30-minute conversation that could be 3 hours without trying if we wanted to. But I think there's so much, there's always hope. And I think there's always potential for change and for stimulating the body's ability to heal itself. Dr. White, you mentioned one of the principles of naturopathic medicine being that docere, or doctor as teacher. One of the other ones is the healing power of nature, the vis medicatrix naturae, where we're using nature outside of us, whether it be plants or in nature or whatever, to really stimulate that nature inside of us to help our body find that healing, because it really has this amazing ability to heal itself that we just need to figure out what the barriers are, get them out of the way, and let the body do its job.
Yep, we find finding the underlying root causes, which sometimes are multiple, but you find them, you identify them, we address them, and as Holly said, sort of our goal is that we help parts of your system heal so that you can move on to paying attention to other things or doing other things. But it's ultimately about trying to help the body achieve the most optimal health that you can with a wide toolbox full of tools. So thank you all for paying attention and for tuning into this, and great to work with the two of you, and we'll see you next time.
Yes, thank you, everybody.
Great. Thanks. Bye-bye.